Hi guys, this is Lei for Open Up and Speak. Today, I'm going to talk about depression, what you need to know, and how to handle it. In behavioral beliefs, they say that man is 70% emotional and 30% rational. But of course, that is debatable. Fact is, feelings affect human behavior. Feelings of joy, anger, hate, excitement, passion, and grief. These are a few of emotional outbursts that are evident in man, affecting its social interactions and decisions. But how about when one feels totally at its lowest point of vitality, sad, insecure, as if everything is unbearable and hard? How will you respond? How will you help? Let us try to know more about depression. Depression is a common mental health problem that is serious. This is a mood disorder that causes persistent sadness, feeling of hopelessness, of guilt, and low self-worth. This is a very complex state that its causes are difficult to understand. It may include biological aspects like genetics. It can be by way of illness or injury. It can also be psychosocial, like experiences. What is odd about this is the fact that persons who actually have depression do not even know by themselves what they are feeling and why they feel that way. They don't even realize that they are suffering from depression. But there are other people who can easily spell out their sadness as depression. They tend to self-diagnose their feelings or issues. These are the types of depression. 1. Major depressive disorder. 2. Persistent depressive disorder. 3. Bipolar disorder. 4. Postpartum disorder. 5. Premenstrual dysphoric disorder. 6. Situational depression. And 7. Atypical disorder. Major depressive disorder, MDD. This is characterized as clinical depression. There is a persistent and intense feeling of sadness for extended periods of time. The following are its general symptoms. 1. There is a sudden change in appetite, whether gain or loss. 2. Feeling of unusually tired or lack of energy. 3. Feeling of despair. 4. Loss of interest to a hobby or something regularly done. 5. Irritable, or most of the time, angry. And 6. Confines self in the room and does not like to communicate. Persistent depressive disorder, or PDD. This is also known as dysthymia. This is a long-term type of depression. If you have PDD, even festive moments does not appeal you, as if you are confined in a room of total despair. The following are its general symptoms. 1. Lack of sleep or excessive sleeping. 2. Feeling of being worthless or in total guilt. 3. Feeling of inconsolable sadness. 4. Mood swings. 5. Urge of just being alone. 6. Avoid social activities. 7. Hopelessness. And 8. Frequent thoughts of death and suicide attempts. Note that although it is more frequent for women to attempt suicide, but men are far more likely to complete the suicide act. Bipolar disorder or manic depression. This is characterized as extreme mood disorder because of its unprecedented highs and lows occurrences. episodes of major depression is observed. The following are its general symptoms. 1. Fatigue and unexplained body aches. 2. Insomnia. 3. Irritability. 4. Anxiety. 5. Crying spells. 6. Indecisive or fickle-minded. 7. Hopelessness. 8. Low self-esteem. 9. Suicidal thoughts. And 10. In severe cases, with hallucinations, delusions, and paranoia. Before we proceed with the other types of depression, let me first give you the important things to be done for the following: major depressive disorder, persistent depressive disorder, and bipolar disorder. 1. Seek help of a psychiatrist for correct diagnosis and medical treatment. They may give you antidepressants or serotonin inhibitors. 2. Regular sessions with a psychotherapist to replace negative feelings and increase self-esteem. 3. Always have a well-balanced diet. 4. Avoid alcohol. 5. Avoid processed foods. 6. Daily exercise or attend yoga sessions. 7. A support network should be present. Reach out and open up. And 8. A hospital or a suicide hotline number should be posted in any accessible place in your house. Next, we have postpartum disorder. This is a complication of childbirth, whether chemically induced or the effect of the complete process of childbirth. It can also be brought about by hormonal changes affecting the placenta. General symptoms. 1. Feeling of insecurity. 2. Crying spells. 3. Loss of appetite. 4. Hair loss. 5. Mood swings. 6. Feeling of being ugly. 7. Feeling of being cheated. And 8. Feeling of despair. If you have this type of depression, these are the things to be done. 1. Husbands or partners should be more understanding, loving, and caring. There should be no room for any relationship stress at this time. 2. Nursing mothers should always have a well-balanced diet. 3. New mothers should reach out to fellow mothers and share experiences. 4. Seek help of a psychotherapist for a guided CBT, cognitive behavioral therapy, and IPT, interpersonal therapy. Talk about your worries and concerns and how you will cope with your feelings. And 5. If depression persists for more than 3 weeks, to consult a psychiatrist for an immediate medication. Next, we have premenstrual dysphoric disorder, or PMDD. This is a condition in which a woman manifests depression symptoms before and until the first day of their menstruation. General symptoms. 1. Irritable. 2. Anxious. 3. Extreme mood swings. 4. Loss of appetite. 5. Feeling of sadness and pity. If you have this type of depression, these are the things to be done. 1. You need to have proper diet. 2. Regular exercise or attend yoga sessions. 3. Seek help from a gynecologist to prescribe birth control pills to alleviate the premenstrual syndrome or PMS. And 4. For persistent cases, to seek help of a psychiatrist to prescribe medications or visit a psychotherapist to talk about your feelings. Next, we have situational depression, ST. This is characterized as a stress response syndrome. It is triggered by sad events in life like death of a loved one, divorce, loss of employment, imprisonment, school problems, or harassment. General symptoms: 1. Feeling of total sadness. 2. Hopelessness. 3. Feeling of guilt or betrayal. 4. Loss of appetite. And 5. Lack of sleep. If you have this type of depression, these are the things to be done. 1. Family should be the first source of moral support. If the family happens to be the cause of depression, then friends should be there to give comfort. Someone should always be there to talk to or confide with. 2. Allow the person to pour out his or her emotion. 3. Allow the person to take a leave or vacation, but there should always be a companion. And 4. If the depression takes more than 3 weeks, then seek the help of a psychiatrist and a psychotherapist at once. And finally, we have atypical disorder, AD. This is characterized as seasonal depression. In this type of depression, as soon as there is a nice or cheerful event, it automatically improves the mood. General symptoms: 1. Feeling lonely. 2. Feeling of being unimportant and left out. 3. Feeling of overly criticized. 4. Loss of appetite. 5. Abrupt loss of vitality or enjoyment from that was once pleasurable. And 6. Problem and focus and how to concentrate. That's it for today. If you like this video, click like and subscribe. Comment on what topic you'd like to discuss next time. You can also email us at openuplandspeak@gmail.com because it's never too late to reach out.